Welcome to Mental Health Mini number 29 on electroconvulsive therapy, also known as ECT. ECT is a therapy where we induce a seizure to help reorient brain chemistry. Individuals that receive ECT therapy will receive it 3 times a week for 12 sessions, so it lasts about a month. They can also be prescribed maintenance ECT therapy where they receive the treatment monthly or at extended intervals. It is used to treat depression, bipolar disorder, schizophrenia, schizoaffective disorder, and catatonia. The process of ECT therapy is the individual is brought into the procedure room where they receive anesthesia and muscle relaxants. We ensure that the patient is monitored throughout the procedure and that they're hyperoxygenated so that they don't lose too much oxygen during the therapy. They can also have oxygen administration if needed. Then the shock is induced. The shock that induces a seizure is very, very small and isn't even enough to light up a Christmas tree light bulb, but it does cause a seizure that lasts about 30 to 60 seconds. The patient doesn't experience all of the convulsions that they may experience with a normal grand mal seizure because they've been given those muscle relaxants. So much of the seizure activity is in the brain alone. However, you may see some twitching in the hands and the feet. There's 2 different ways that the shock can be induced depending on the purpose. It can be either bilaterally, where we're shocking both sides of the head, or it can be unilaterally, where we're only shocking one side of the head. And you can see the placement of the electrodes for each of those on the right. Then after the seizure is completed, we take them out of sedation and monitor them in the recovery room. Nursing care and considerations. Pre-procedurally, we would want to educate our patients. This can be a very scary procedure for them, and it would be important that we really educate them on the benefit to it, the safety precautions that are taken, as well as any side effects that may occur. The most common side effect that is experienced through ECT is that individuals may have limited memory retention during that month of treatment. However, it does not impact their ability to form new memories, and it does not impact their ability to retain memories that have been prior to the start of treatment. We would also want to provide patient support, especially if they're experiencing anxiety or doubt about the treatment. We would want to take baseline vitals and assessments prior to going in for the therapy, and we may be responsible for IV placement. After the procedure, we would need to monitor sedation and vital signs. We may treat them with pain control, especially a lot of people report having a headache afterwards. They may have a little bit of disorientation for the first couple of hours following treatment, and they may also have some muscle weakness, so they would be a fall risk as well. Long term, we would see an improvement in symptoms of depression. We would want to provide encouragement and help with coping with any potential memory loss they may have incurred. And that wraps up our mental health mini on ECT therapy.